this video, I want to talk to you about a question that most people don't ask, but they really should ask. It's what services are not typically offered in adult family home. And you may very well be dealing with a parent or a loved one or a spouse who may need some of these services, so you definitely want to ask and find out if any of the 5 items I'm going to talk to you right now are offered or are available in the adult family home that you're considering. First one is transportation. Not all adult family homes provide transportation. Many reasons for it, from cost to liability to staffing requirements that you have to have. So you must ask, and you must also ask if there is a cost associated with the transportation service if it's provided. Number 2, injections. Injections, the Washington State has very strict rules about injections. The one type of injection that can be given are insulin injections. And then the other type of injections are typically not allowed unless they're given by a licensed nurse or a registered nurse or someone who's licensed by the state to administer injections. So if your loved one needs injections on a regular basis, you definitely want to make certain that they can be offered in the adult family home that you're considering. Number 3, violent behaviors. Well, that's a tough one. Some homes are set up for that. Some homes have a dementia specialty. But more than just the dementia specialty, you need to make sure that the provider actually does provide care with people with dementia and advanced dementia, and that is actually a specialty that they do. Most adult family home providers do have a dementia specialty licensed, but not all of these provide care for people with dementia. And that's because the way the rules are, if anyone has a diagnosis of dementia, you have to have a dementia specialty license. And that's very easy to do. If a senior has got some memory loss and they can't tell you where they live or what time of the day it is or what time of the month it is, which is very easy for them to do, they will have a diagnosis of dementia. Therefore, the care provider must have a dementia specialty license. But between you and I, we know that just being confused about the time of day doesn't mean you're going to have violent behaviors. And so the type of care that you provide is still very, very different for these types of dementia. Okay, I hope that made sense. Restraints, physical restraints. If we have people that are violent, we cannot use physical restraints. The type of license doesn't allow it. The rules for using restraints are extremely complicated. You pretty much need to be in a hospital, maybe in a nursing home, but certainly in adult family homes, these are not typically offered. And finally, the last one is what we call elopement. So these are, we're talking about someone with dementia who is confused enough that they feel they need to leave the home to go somewhere, maybe go to work, go home, and no matter where they are, they just know that it isn't home, so they're trying to leave. That's a tricky one because it's a safety issue. So some homes, I mean all the homes typically will have alarms on the doors, but sometimes that's not enough to keep someone safe. So then we're wanting to look for a home that has a secured perimeter as one option, or that is specializing in dealing with people that are high elopement risk, as we would call it. All right, so these are these are services that are not typically offered, and if your parent or your loved one or your spouse has any of these, make sure you find out the answer to these specific questions so you don't end up being disappointed later down the road after you've moved in. If you enjoyed this information and you would like to receive 20 more free videos on the most frequently asked questions that people ask about adult family homes, and a copy of my ebook called Everything You Should Know About Adult Family Homes, please visit adultfamilyhomescentral.com/free.